My name is Mitchell Cohen. I'm the chair of surgery here at Denver Health.
Good evening. I am Dr. Ernest Moore, and actually was the first chief of trauma here in 1976, and have been a trauma surgeon at Denver Health for the ensuing 42 years.
We see everything, as the go-to level 1 trauma center. We see everything from victims of automobile crashes and people being struck by cars, to falls, to the traditional knife and gun club injuries of violence, including stabbings, shootings, injuries from the rodeo, injuries from rural Colorado, a fair number of ski and snowboard crashes. I think if you name it, we've seen it.
My name is Eldon Cross, and I live in Denver, Colorado. Back in the day, like in 2010, I was a young bunkin, you know what I'm saying? 21 of age, just started my life, and I never thought in my being life that I would be shot. You know what I'm saying? Nobody looks forward to being shot or putting in the repertoire being shot. The person that took care of me on that first shooting was Dr. Moore. I never met him. It was just like a regular surgery, a doctor that could do something for me. And I always thanked him that day, you know what I'm saying, but not knowing him, never meeting him, never seeing these pictures that I see through the Denver Health situation. So basically, I got shot again. And this time is 2018. I'm in the same hospital. I died in a different area, but I ended up in Dr. Moore's same trauma surgery. He noticed me. I didn't notice him. He knew that he was working on the same body that he worked on 10 years ago. I never thought I'd be shot again, but I just know I love that man, Dr. Moore. And when I heard that he's the one that helped me out again, it blew my mind, because he's seen my body again after 10 years. That's crazy. That's like, you know what I'm saying? It's just magical that could happen, that the same person that took care of you the first time can take care of you again. I'm just blessed. I feel like he is the guy that's made me come back. And I've been shot. I'm shot right now, but I don't look like it. It doesn't seem like it. That's how good he is. I don't even like, and that's not just fun to just like, you just get shot and go see Dr. Moore and you're okay. It was an eye opener. I just love that man. Thank you for everything that he's ever done, you know what I'm saying, just to bring me back. Like, wow.
Yeah, he's my private patient.
You damn right. I'll take a surgery for free again.
No more of those metal things. We'll fix everything else up, but no metal fragments, right? That's the deal.
One thing that's unique, I think, about Denver Health, aside from being really a gem of the city and being able to treat the victims that are close enough to come to us with bad injuries or illness, we see it as our obligation to not only be the resource hospital for the city, county, and region, but really to be the resource for trauma for the world.
The support for research and education have become increasingly challenged in the current paradigm of medicine. And we need to fund these because that not only is important for patient care, but it also is the way we'll have most cost-effective medicine.
The academic research that Dr. Moore and others have done for decades is quite literally second to none. We have genuinely written the literature of trauma and quite literally written the textbook on trauma here at Denver Health. And that combination of thinking constantly clinically about how we can be better, thinking constantly academically about how we can fundamentally define the science that will make us clinically better, and that esprit de corps of teamwork, of people, the geeks have come home here, and people genuinely want to be better at every subsequent patient and genuinely want to be the best at what they do. Makes us, frankly, the resource level 1 trauma center for not only the city, county, state, and region, but also the world.
Well, I'd like to conclude by thanking everyone tonight for your tremendous support of our trauma center. Without you, we cannot continue the research and education which we think are fundamental to our mission.